The medical office terminologies. Short stay record. So when a patient is being sent to an outpatient or surgical or diagnostic center, a shortened form of the history and physical is okay. Next, this form is good for many diagnostic procedures and minor operative procedures. The statistical data would be the same as those required on the longer forms, but the description of the patient's condition and the history would be a lot shorter. So, yung short stay record, from the word short, ibig sabihin maiksi. So, ibig sabihin, maiksi lang yung mga information na naka-indicate doon. And more on na binibigay ito sa patient kung sila ay ipapa-opera o magpapa-check up. Naglalaman to ng mga medical history and the physical history of the patient. Katulad din siya ng statistical data, pero yung statistical data is nagre-record ng longer forms na andun lahat naka-indicate. But this, ganun din siya, pero mas pinaiksin, ganun. Hindi pong makikita agad yung history of the patient kasi yun naman talaga yung importante. So, I have the example here. Naglalaman nito ng, of course, pangalan and the number of the patient. Next is the history. History of the patient. Kung sino ba yung patient na yun, ilang taon na siya, kung bata ba, matanda, ganon. Kung ano yung kino-complain niya, ganon. Next is past history. Ito naman nakalagay kung meron bang family history sa ganitong sakit. Kunwari, may allergies sa ganito, ganon. And the last is the physical examination dun sa pasyente. Yun yung nilalaman ng short stay record. Next, interval history. If the patient returned to the hospital within a month of being discharged and has the same complaint, a complete H&P does not have to be written on the patient. However, an interval history or an interval note is completed to describe what has happened to the patient since the discharge. Last, the complete statistical data are used but the medical information is shorter. The history would include any new findings since the last examination. Itong interval history naman, ito yung form ng mga pasyenteng bumalik sa hospital pagkatapos nila ma-discharge na mga ilang buwan nang nakalipas. Kapag may ganitong situation, hindi na kailangan ng medical history kapag nakukunin sa pasyente. So, ang interval history or interval note ay naglalaman ng kung ano ang nangyari sa pasyente since noong na-discharge siya sa hospital na yon. Parang katulad lang din siya ng short stay record. Kompleto rin na nakasulat doon ng statistical data, but the medical info is maiksi lang din. So, nilalagay sa interval history is yung new and the last examination findings of the doctor or the physician. So, meron akong example dito ng interval history. Yung interval history naglalaman ng present complaint, kung ano ba yung nararamdaman, kunyari, yung pagbabalik ng pasyente sa ospital, kung ano ba yung nararamdaman niya ngayon sa pagbabalik niya. Next is the past history. Doon naman naka-indicate kung ano yung dahilan nung pagiging hospitalized niya last or nung dati, ganun. Naandun din yung physical examination ng pasyente. Meron ding naka-indicate dito ng impression ng physician at saka yung advice for this patient. Next is miscellaneous medical reports. Discharge summaries. A discharge summary is a clinical resume or final progress note. Discharge to leave the hospital with permission from the doctor. So, ang miscellaneous medical records, itong form na to ay binibigay sa mga pasyenteng i-discharge na sa hospital. So, naglalaman naka-indicate sa miscellaneous medical records ang permission ng doktor na pwede nang i-discharge yung pasyente. So, meron akong example dito na miscellaneous medical records. Naglalaman to ng, of course, name of the patient, the number of the patient, and the date. Next is nakasulat dito yung admission date and the discharge date of the patient, the history of the present illness, the physical examination of the patient, the admitting diagnosis, yung dahilan kung bakit inadmit yung pasyenteng yon. Next is laboratory data on admission. So, nakalagay din doon. Next, meron din hospital treatment, kung ano yung treatment ng hospital na ginawa sa pasyente. Meron ding surgical procedure. Ilalagay lang to kung meron nga bang ginawang surgical procedure dun sa pasyente. This optional, pwedeng hindi ilagay kung wala naman talagang surgical procedure na ginawa sa pasyente. And meron ding discharge diagnosis of the physician. And of course, the signature, the name and the signature of the physician. Operative reports. Whenever a surgical procedure is done in a hospital, an outpatient surgical center, or a clinic, an operative report should be dictated or written in a medical record soon after the surgery. So, meron lang ganito kapag may ginawang surgeries sa isang pasyente. So, the operative reports are dictated or written in a medical record soon after the surgeries. Kailangan pagkatapos ng surgery is ginagawa mo na agad itong report na to because ang naka-indicate doon sa operative reports is kung paano iginawa yung surgery doon sa pasyente. So, sa nakikita niyo dun sa example ko, naka-indicate dito yung pre-operative diagnosis, post-operative diagnosis, and the operation, dahilan ng operasyon. So, nakikita niyo dun sa paragraph sa ilalim, mahaba. Ganyan ginagawa ng mga surgeons yung operative reports. Ganyan ginagawa ng mga surgeons ang operative report nila. But, sinabi dito na some hospital require that surgeons separate the report into subheadings such as anesthesia, incision, findings, procedure, closure, and so on. Mas madali nga naman kasi talagang maintindihan kapag may mga ganon. Next is pathology report. Pathology report as a medical transcription, you can specialize by typing pathology or radiology reports. Pathology transcriptionists work in a laboratories, hospital, medical laboratories, and coroner's offices. So, yung pathology reports or yung mga pathology transcriptionist ay gumagawa sa mga laboratories, sa mga hospital or medical laboratories or the coroner's office. Naglalaman ito ng date, ng name of the patient, and the name of the physician. So, naka-include din dito yung diagnosis or yung sakit nung isang pasyente, kung kunwari, tumor, ganon. Naka-include din dito yung description kung gaano kalaki yung tumor, ganyan. Kung type A, type B, ganon. Dito rin nakalagay yung microscopic description. Kung type A or type B ba yung laki nung tumor. So, naka-include din dito sa pathology reports yung diagnosis. And of course, the name of the physician or the MD. Next is radiology and imaging reports. Radiology, the scientific study of the medical use of radiation, especially in X-ray. So, radiology, ito yung pag-aaral ng paggamit ng radiation, especially sa X-ray, CT scan, MRI, NMR, ganon. So, the common radiology and imaging reports are as follows. The X-ray, the CT scanning or the computed tomography, the MRI or the magnetic resonance imaging, the NMR or the nuclear magnetic resonance. So, I have the example of radiology report dito or imaging report. So, naglalaman ito ng technique. Maybe siguro yung technique na yan yung sa radiation. Next is naglalaman din ito ng findings. Kung ano yung mga nakita doon sa mga test na yon. Next is consultation report. Consult means seek advice from someone. Example is one doctor asking another doctor. So, dito sa consultation report is maybe seeking advice, maybe the physician seeking advice for another physician. Ganon. So, I have an example of consultation reports here. It is like a normal letter, meron siyang headings, date, address information, may salutation, may letter of the body, ganon. Pero kung babasahin nyo to, nakasulat lang dyan is nagre-reply siya dun sa isang doctor na nagtatanong tungkol sa mga symptoms ng ganito, ganyan. Yun. Next is psychiatric reports. Psychiatry is one of the specialties of clinical medicine. It is a varied field, and the language involved abnormal psychology, human behavior, and treatment terminology. Patient referred to as clients. In a hospital setting, clients include the mentally deficient or MD and the developmentally disabled or the DD. A report by a clinical psychologist would not necessarily contain a physical examination of the body system or a list of the medications. The main heading might be psychologic evaluation. The subheadings might be given as follows: the purpose of the report, psychosocial history, result of the psychologic assessment, mental status examination, test result, impression, diagnosis, and recommendation. So, psychiatry, it is a varied field. Magkaiba yung psychiatry sa mga doktor sa physical. So, ang ginagamit pala sa psychology, sa psychology pala, merong ginagamit din ng mga term for mga term. Maybe for not getting offended to the patient. Kasi ang example dito binigay is, the patient are not called patient but actually called clients. So, yung psychiatric reports, hindi siya katulad ng mga naunang na-discuss na reports or forms. These psychiatric reports not contain any physical examination. So, yung makikita mo nga dun sa subheadings ng report na to is psychologic evaluation. So, I have an example here of psychiatric report. Ang nakasulat dyan is, sa taas, is psychiatric evaluation. So, sa psychiatric reports, ito yung mga nilalaman nun. In the purpose of the report, the psychological history, the result of the psychological assessment, the mental status examination, the test results, the impression, the diagnosis, and the recommendation of the physician or the psychiatrist. Psychiatry is the part of medicine that studies illness. Psychiatry, ito yung pag-aaral ng mental illness. Yung psychologist naman, ito yung mga taong nag-aaral ng human mind or human emotion and behavior. So, that's all. Thank you.